Hey everyone, in today's video we're going to be talking about the first paper I was able to find that discusses negative vaccine effectiveness. So we're going to talk about what that means, how long has that been observed, and why this might be visible with the age of the Omicron. But first, my name is Dr. Mikola Rashek of Mero Genomics, and before we get going I wanted to remind you we have another COVID Q&A event coming up. So please stay till the end of the video to find out how you can get free tickets to that. Those are a lot of fun. Basically, those are our COVID Q&A support questions, if you will. Alright, so let's get going with this. I finally came across the very first paper I've ever been able to see. It's not a peer-reviewed paper yet, it's actually a preprint, meaning it hasn't been peer-reviewed yet, but it's the first paper of its kind that I was able to find which actually discusses vaccine effectiveness and reports negative vaccine effectiveness. So what does that mean when you report negative vaccine effectiveness? It means that the vaccine right now, when the people who were studied in this particular publication, the vaccinated people were more likely to be infected than unvaccinated, meaning post-vaccination it increased the likelihood of infection by SARS-CoV-2 than without vaccine. Now the paper studied entire UK population, so this is based since the start of the pandemic. So they assembled data points available from public databases that included over 22 million infections, or around 22 million infections, something in the order of 900,000 hospitalizations, and somewhere around 175,000 deaths in the span of the entire pandemic. And what the authors observed when they were looking at vaccinated versus unvaccinated, what they were able to notice that since the third booster became negative in its efficacy since December 20th, 2021. So ever since Omicron came on board, vaccine effectiveness became negative, and we're going to be discussing potential reasons as to why that might be, that we are losing vaccine effectiveness because of the Omicron. This negative vaccine effectiveness has been reported for a long time. Actually, it's already been, when they calculated this, they were able to measure it as negative vaccine effectiveness since August of last year. So we're talking about a year later. So this is a bit of a surprising to see a year time span before we see anything reported in scientific literature with regards to this effectiveness. And what happened is, basically, once Omicron showed up, ever since January of this year, the vaccinated also now start reporting increased death rate in comparison to unvaccinated. And a month later, since the mid-January, when there was this increased rate of death amongst vaccinated in comparison to unvaccinated, since February, the authors were mentioning that those who had a third shot, they also started to report worse death outcomes in comparison to all other tested groups that included those with 2 doses of vaccination as opposed to unvaccinated. So really startling news. Also, another information I can tell you is that Omicron took a massive toll on the UK population. 50% of all infections in the history of the pandemic in the UK were attributed to the Omicron family of variants. That included somewhere around 30% of all hospitalizations and approximately 16% of all deaths since the start of the pandemic were also attributed to the Omicron. And clearly, with the Omicron and the emergence of these immune escape variants, sadly now vaccinated are not doing very well, and this pronounced effect of experiencing more cases, experiencing more hospitalizations, and experiencing more deaths amongst vaccinated in comparison to unvaccinated that is especially pronounced in the elderly. So the authors even of this significant publication even comment about the fact that we possibly might be doing a public policy error, and that we should be considering mass screening and take more active efforts in protecting our elderly, especially from getting infected, in order to basically protect them from some of these horrible outcomes that we have been seeing ever since the emergence of the Omicron variants. Now, why are we observing these unusual or really sad outcomes for the vaccinated right now with the Omicron family? And there's been some really interesting emerging data coming out as well that might help to explain this. And one of the contributing factors might be a concept that I've already introduced previously in a couple of my videos, which is the concept of imprinting. What that means is that once you get vaccinated, you program your immune system to respond in a specific manner that relates to what vaccine you were vaccinated with. Basically, what genetic material in this case was injected into an individual. And there was a study that looked at antibody response in vaccinated people, and it was really interesting what they did. They looked at vaccinated people, they looked at their antibody responses, and they see how well those antibodies were able to neutralize virus infection of cells in basically lab cultures. And they were able to show that post-vaccination, these antibody amounts were quite low, and there was a very little neutralizing capacity left available amongst those antibodies that vaccinated individuals were producing, that were able to actually neutralize the virus. And in this case, the authors looked at the original pandemic starting variant, the one variant that basically we vaccinated our entire population with against that particular variant. And then they looked at as well the entire family of Omicron variants, starting from BA1 to the current problematic ones, which are the BA4 and 5 right now, right? And what they were able to see, that there was very little neutralizing antibody capacity after the second booster. Then after third booster, those neutralizing antibodies increased quite dramatically in amount, but predominantly their neutralizing capacity increased for the original variant. And then for each Omicron variant, that neutralizing capacity was significantly lost. And that's what imprinting refers to, is that the body responds predominantly to attack the type of variant that individuals were vaccinated against. And these antibodies can clearly still target Omicron family, but the effectiveness of these antibodies is just lost dramatically. So the way they tabulated it in comparison to the original variants, the pandemic starting variant, those who were boosted with a third shot, the capacity to neutralize BA2 variant, Omicron variant, was already 7-fold lower than in comparison to the original variant. And then if you were to look at the BA4 or BA5 variants, the capacity to neutralize these particular variants was already 20 times lower in comparison to the original variant. And what's interesting is that the authors also looked in that particular publication, they also looked at those who were double vaccinated and then infected with one of the BA1 or BA2 Omicron variants, and their response was much more extended, meaning they had produced much more neutralizing antibodies than those who got a booster, approximately double the amount of antibodies, but the pattern was the same, meaning the efficacy of these neutralizing antibodies dropped right away against the later versions of the Omicron variant down to the BA4, BA5. There's other publications that are now showing the same pattern, that with the BA4 and BA5 variants, they are basically, what all of this means is that they are escaping the neutralizing capacity of the antibodies that we are producing against them. And there was another study that I want to mention in the same vein, is that can be very global, so this is not necessarily vaccinated versus unvaccinated, because Qatar also published really interesting information where they studied all of the population and how the population responded to different variants. And what they were able to show is that pre-Omicron infection in a population resulted in subsequent protection against the latest Omicron variants, BA4, BA5, against symptomatic infection. The efficacy of that protection of prior natural infection, whether you're vaccinated or not, was about 15%. That's 1.5. And then against any infection, whether it's symptomatic or asymptomatic, the effectiveness of infection, natural infection prior to Omicron, was about 30% against reinfection with one of the current BA4, BA5 Omicron variants. But if you got infected with either BA1 or BA2 Omicron variants, the protection against subsequent reinfection with the BA4 or 5 Omicron was much larger. So against symptomatic infection, that effectiveness was still 75%. Against any infection was about 80%. So once again, it shows you this effect of potential imprinting, how whatever variant you might have been either infected with, or whatever variant, genetic information variant you've been injected with as part of vaccination program, that information is basically now what your body wants to respond towards whenever we get reinfected. And because of the continuously evolving variants, Omicron variants are not only becoming more infectious, but they're also are escaping the ability for our antibodies to neutralize these variants effectively. You can see this drop of effectiveness across the entire board. So that's one possible reason as to why vaccinated individuals right now might be exhibiting negative vaccine effectiveness, and that's because their ability to neutralize variants, current Omicron variants, is worse than those who have not been vaccinated and exhibit natural response to basically exhibit different response post-natural infection if they've never been vaccinated and those who were vaccinated. So that's one possible reason, but there might be another reason as well, and want to discuss another publication as well. Those are very brief, basically like reports that were published that I wanted to mention. And basically in this particular report, what the authors mentioned is that they looked at how quickly post-infection in a vaccinated versus unvaccinated group of people did the virus infection end. And the way they measured end of infection was in one and two ways. So number one, what they looked at was, once you become PCR positive, it indicates you are now infected. And these were symptomatic infections, except maybe one. All of them were symptomatic. And then what they were looking at is, let's see when you become PCR negative. So that was one way. But what's really cool is that these authors, what they also looked at is they isolated the virus from the swab samples that were collected from these patients. And that's the most authentic and real way to determine the actual clinical effectiveness of a sample because you are truly then isolating virus from that sample, so then you are dealing with the real deal. And the question is, how soon after you've been infected with the virus you no longer can isolate the virus? That clinically means there's no more virus eventually in your body, and you have cleared it. At that point you still might actually be able to be positive, PCR positive, even though there's no more virus in you that can be cultured. So they did both. They looked at the PCR positive outcomes, as well as what they did is they also looked at when can you no longer culture the virus. And the authors concluded rapidly that there seems to be very similar virus decay history, whether people were infected with Delta or Omicron, so they didn't observe major differences. And they also concluded that they didn't see major differences between vaccinated versus unvaccinated. But when you look at the data, it's quite visible that those who were unvaccinated were able to clear the virus faster than the vaccinated. So you can see that in the plot, that vaccinated group, they were able to persist being infected longer. They took longer time to be able to clear the virus than individuals who are unvaccinated. So that might be another reason why overall that could be contributing why with the Omicron variants we might be seeing negative vaccine efficacy. Really important information that has been taking super long time to come out into the public view in any scientific literature. It's, as I mentioned previously, this is the first time I'm seeing it myself that's being published. And again, remember, this is preprint, so it still awaits peer review, but there's clearly a demonstration that Omicron with the latest variants is still happening to become more infectious, and it's still happening to be able to escape more and more neutralizing antibodies. And for whatever reason, which from an immunological point of view we are still not fully aware of what these reasons are, those who were naturally infected and unvaccinated can overall respond better in terms of being able to be protected from infection than those who are vaccinated. And that's especially seen in the most vulnerable groups, which are the elderly, which we would define as anyone over 75 years of age. So clearly we have to still consider how we should be protecting those individuals in order to be able to make sure that they run the most reduced risk of infection possible. All right, I know this was a complicated topic to explain, and a lot of data that I'm discussing. So if you're here with me, I still want to let you know that we have another COVID Q&A event coming up, and basically we answer top 10 questions that we collect from the audience, online audience, and then it's open mic, and that's basically where the audience gets to ask questions, whatever questions they want. It's for all levels of knowledge. There is no particular necessity of background information to attend these. And then we also welcome comments, information, ideas to research and investigate. So please check it out. And we have another event coming up. This is me getting together with a couple of my colleagues, and together we have a program. We educate about a program we developed for business owners to offer to their employees, where they can basically offer the program about proactive well-being for the employees, so that we teach about different tricks and methods of how we can improve well-being, personal well-being, from variety of different angles. So hence we have a financial advisor, mental health advisor, and then myself. I talk about being proactive about your physical well-being and what you can do in order to minimize potential future damage in relation to that, including use of DNA testing in relation to that. So if you're a business owner, please check it out. It's easy to attend, it's free, and it's easy to attend that first seminar, because we just educate about what that program is. All right, I look forward to seeing you guys in a future installment of another video. Please subscribe to the channel if you haven't already. Give us a like, share the video, comment. Those are always welcome, and we look forward to seeing you guys again in the future. Bye everyone.